All right, good morning, everyone, and welcome to the third and final day of the OFA Regions 4 through 8 Tribal TANF and new program meeting. My name is John Disk, and I work as a TANF program specialist with OFA in the Dallas office. A little bit about myself. I graduated from the University of Texas at Austin with a degree in anthropology and an emphasis in archaeology. I worked for the Texas Historical Commission as an underwater archaeologist and then as a computer programmer analyst for the state of Alaska. I left Alaska for law school and a career as an attorney representing people with disabilities in Colorado and in Texas. And then I joined the federal workforce 15 years ago, and now I work with TANF and new with 4 states and 4 tribes in Region 6 and 8. And that's my story so far. So as we get started on this final day together, let's go over our agenda for the day and also do another short icebreaker, and that will come up a little bit later. May I have the next slide, please? Thank you. So as was seen throughout the meeting already, each day has a particular theme, and today's theme is going to be offering supports that enable job attachment and growth. And that I'm looking forward to that. I think that's going to be a very good one. This theme, like the others, was chosen based on feedback we received from you as we were planning for this meeting. So while yesterday's focus was on employment, today's focus is an important logical follow-up on that conversation. Today we focus on those things that TANF customers may need to engage in the workforce today. For example, we'll be hearing and learning about resources relating to childcare and mental health. We'll also be exploring how to grapple with those situations where TANF customers may be reluctant to join or even reluctant to rejoin the workforce today. As we cover this theme, we'll first have a plenary session about promising and innovative approaches and resources. And then we'll follow that up with breakout peer exchanges, much as we did yesterday. Finally, like yesterday, we'll brainstorm and work together to create something that may help you and your programs continue to explore ways to connect TANF customers to the supports they need. And the template we'll be working from for this final session was emailed to every participant earlier this week. So if you're joining by phone, you should have it in your email inbox. If you don't see it there, check your junk box. Sometimes things happen like that. It'll also be shared at the Create session later today through a screen share by our moderators, so everyone on the Zoom link will have a chance to see it. You have the next slide, please. Okay, so here is the icebreaker question for today, and I'll read it out loud for those on the phone. Please share one word that reflects the support Tribal TANF and new programs should provide its customers. And as you think of your ideas and come up with them, please enter them in the chat. So once again, please share one word that reflects the support that Tribal TANF and new programs should provide to its customers. And as you're thinking, I'll share with you the idea that always comes to my mind, and my mind always focuses on donuts. So if you're tempted to enter the word donut, it's already taken. Understanding, there you go. Yes, donuts. Okay. I have competition. Patience. Oh my gosh, yes, I understand. Empathy. We all need that. We all need that. Understanding, growth, very good. Opportunity, Jonathan, excellent. Opportunity in creating opportunities. No judgment, a judgment-free environment, very, very important. Empathy, encouragement, accountability. Oh my gosh, that really is very important. Accountability without blame, I think, is excellent. To be heard. Very, very important, to be heard, to be understood. Incentives, very practical, very practical. So all of those are really just wonderful ideas to throw out. And I think there's something that we can all gain from that and we can all reflect on. So thank you everybody for coming up with your ideas and also for participating with us over these past 2 days and on this day that's still ahead of us. And our appreciation all goes out to those who planned and supported this virtual meeting and who did such a good job with that and are continuing that. So now I'll turn things over to Steve for a logistics overview. Steve, it's all yours now.
Thanks, John. I know this is your favorite part of the meeting each day. I apologize for those of you who have seen this before, but we have had a few new faces each day, so we want to make sure everybody has the same information. So as we've mentioned, the materials, the agenda, the speaker bios, all of that is available on the meeting website. You receive a link to that in the daily reminder. Today will be the last daily reminder you'll get from us, so I'm sure you're excited about that. If you have any issues downloading or accessing any of the materials, please contact your regional office and they can assist you with getting those materials to you. We ask that you remain on mute until it is time for discussion. We want this to be interactive, but please also be respectful of other folks while they are talking. We do have captions available if needed. You can click on more at the bottom of your screen and then click on show subtitle. We ask that if necessary, please rename yourself for discussion purposes when you get into the breakout rooms. If your participant name is some sort of mix of letters and numbers, it might be difficult for folks to address you. So if you hover over your name, click on the 3 dots that appear, you can rename yourself into whatever you want. No judgment. You can pick whatever name you like. Again, interactive. So submit questions for presenters at any point, at any time in the chat box, and they will be addressed at the Q&A time. There will be 2 breakout sessions today, Tribal TANF for new, and you will remain in those breakout sessions for 2 different sessions later in the afternoon. So only 1 breakout choice you have to make, Tribal TANF or new, and you'll see that a little later. We'll show you the menu for that. I think that may have been the last poll for the day, but there may be another one. You never know. We'll keep you on your toes. We definitely want to make sure that you hang around and give us a few moments and complete the evaluation survey at the end of the day so we can get your feedback and use that in creating additional meetings for you in the future. And as always, if you need any help, please request assistance in the chat box and we will be there to provide any assistance you might need. Thank you, and I want to turn things over now to Keisha Russell, who will get us started with today's plenary. Keisha.
Thanks, Steve. Welcome everyone to our first plenary session, or the plenary session for today, getting back to work, offering supports that enable job attachment and growth. Next slide, please. So my name is Keisha Russell. I am the Regional TANF Program Manager for Region 6, based in Dallas, and also Region 8 that is based in Denver. Just a little bit quickly about me. I have been in public service for 20 plus years. We won't tell you the exact amount of years, but 20 plus will do. And I started off as an eligibility worker for adult programs in Stillwater, Oklahoma. Go Cowboys. From there, I had the pleasure of moving to Colorado, where I had my first taste of actually working directly with the TANF program and TANF populations, working there at a couple of county offices, and then being able to move up into management until now my position here with the Office of Family Assistance, in which I've been in this position now for almost 9 years. And through this position, I've had the opportunity to work with many of you, even being able to visit some of our programs in Montana and South Dakota and Wyoming. And it's been a joy. So today's session We'll build upon the previous days, I think, as John mentioned, and discussing employment by focusing today on supports and needs customers have to engage in the job market today. Before we begin, however, I want to kind of just go over a couple of things related to TANF and to Native Employment Works to kind of give you some food for thought and some things to be thinking about as you listen to our speakers today. So we're going to talk about quickly just some of the flexibilities that our program has. So one of the first flexibilities that you could do within your program is to increase the monthly cash benefit amount for your cash assistance recipients. Now, this could be a permanent increase, or it could be temporary, especially now during COVID. Temporary increases have been encouraged, particularly with the PEEF funding that you received. So we encourage you all to examine whether your benefit levels provide adequate safety net for your families. Another thing that you could do is to increase the maximum income level for cash assistance eligibility. This would allow more needy families the opportunity to receive cash assistance. One thing to note is many programs have not increased their eligibility criteria to keep up with inflation, and I think you all know that. Since in 2019, the national average maximum income eligibility for a family of 3 was $908 per month. In other words, a family with an annual income above $11,000 or 52% of the federal poverty rate would not have qualified to receive TANF. So we encourage tribes to examine your TANF financial eligibility relative to the poverty level and assess whether your TANF safety net reaches enough poor families. Now, if you decide to do this, please, we encourage you to work with your regional office because there could be changes that are needed to your tribal TANF plan, but that could result in an amendment, and we can help walk you through that process. Another flexibility is you can support the use of information technology by creating or enhancing the opportunity for participants to learn virtually, such as through web-based classes for employment and training, career development, job search, and work readiness. I think many of you have already explored this option of using these classes, but you could actually enhance those or expand the use of web-based training even further. Another thing you could do is invest in skills training for TANF and new participants for jobs that are in demand and pay well in the post-pandemic labor market. We encourage programs to collaborate with the workforce system and education community to facilitate training for the skills needed for the emerging labor market. Such a collaborative effort could include partnerships with other state agencies and organizations that serve TANF and new families, such as the Labor Department, Housing Department, Transportation, your community colleges, charities, and nonprofits. We encourage you to support newly employed families with transitional benefits and services. This could include things such as tools needed for work, uniforms, or other work supplies, and additional transportation assistance. We encourage you to support family strengthening programming. The stress and anxiety that has been caused by the pandemic, in addition to the demands placed on parents to homeschool their children while maintaining a household and employment, have been very challenging. Thus, it is vital to the well-being of children and the stability of the family unit to create and maintain innovative virtual or in-person programs that support healthy marriages, healthy relationships, and responsible fatherhood. We could also expand funding for non-recurrent short-term, the NRST, benefits to support the evolving needs of families when there's a specific episode of need or crisis situation. This could include short-term cash benefits, short-term rental or mortgage assistance, utility and energy assistance, housing, placement services, clothing allowances, family counseling, financial and credit counseling, and even certain legal services. So as you can see, some of their services and flexibilities doesn't have to only depend on the pandemic, but certainly these flexibilities can be included at any time. As I said before, we encourage you to reach out to your regional specialists and to work with the regions, and we can help walk you through some of these processes. So our presenters in the next hour will explore issues of readiness, reluctance, and even fear to rejoin the workforce, but they will also share practical resources to help individuals successfully get back to the workplace. Now, at the end of the session, there will be time for Q&A. So we encourage you to please use your chat box and submit your questions. Our first speaker of today is Hillary Weaver, who is Professor Emeritus at the University of Buffalo School of Social Work. She received her BS from Antioch College in Social Work with a cross-cultural studies focus and her MSW and DSW from Columbia University. Her teaching, research, and service focus on cultural issues in the helping process with an emphasis on Indigenous populations. Dr. Weaver has worked regionally, nationally, and internationally, including presenting at the Permanent Forum on Indigenous Issues at the United Nations. She has numerous publications, including the text Explorations in Cultural Competence, Journeys to the Four Directions, and the edited volume of Routledge International Handbook for Indigenous Resilience. We will then hear from Lisa Blackman-Fergus from the U.S. Department of Health and Human Services Office of Child Care. Dr. Fergus is a senior tribal child care program specialist with the Office of Child Care. She previously served as a program specialist in the Dallas region, Region 6, for over 20 years and provided leadership and guidance to support early childhood initiatives. She has over 30 years of experience working in the fields of early childhood and human services. Prior to her federal career, Dr. Fergus worked as a social worker, domestic violence advocate, and manager of tribal child protection and family violence prevention programs. She is a member of the Chickasaw Nation of Oklahoma and received her undergraduate and graduate degrees in psychology from East Central University in Oklahoma, and a doctorate in early childhood education from the University of North Texas. And finally, we will hear from Captain Karen Hurd. Captain Hurd is the Director of the Office of Tribal Affairs and Policy at the Substance Abuse and Mental Health Services Administration, known as SAMHSA. Captain Hurd is a citizen of the Choctaw Nation of Oklahoma. Her office acts as SAMHSA's primary point of contact for tribal governments, tribal organizations, federal departments and agencies, and other governments and organizations on behavioral health issues facing American Indians and Alaskan Natives. Previously, she served as the Director of the Office of Tribal Affairs and Strategic Alliances within the CDC's Center for State, Tribal, Local, and Territorial Support. Captain Hurd has also served as the SAMHSA Regional Administrator for HHS Region 6, working to advance the agency's mission and improve the delivery of behavioral health services within the region. Prior to joining SAMHSA, Captain Hurd was a behavioral health consultant for the Indian Health Service, Oklahoma City area. Captain Hurd holds a Master of Social Work degree from the University of Oklahoma and is a licensed clinical social worker. Now, there's much more to these three individuals' bios, so we encourage you to go onto the Visible system and where you can read their entire bios. We thank each of you all for being here with us today. I will now turn it over to Dr. Weaver to get us started.
Thank you very much. I am excited to be here with you today. The theme for my remarks is really about moving forward. How do we acknowledge our challenges and how do we embrace our strengths? If anybody would like to be in touch with me after this presentation, I've got my email address on that first slide, so feel free to reach out. Next slide, please. Tell you a little bit about who I am. I'm a mom. That's got to be my most important thing. I'm Lakota. I am a member of an urban Indian community, but I've tried to raise my children in a traditional way so they know who they are as urban Indigenous people, being very grounded. So we often used to dance at powwows. This is an old picture. I don't want to acknowledge that my children are now taller than I am, so I keep showing this old photo again. And I am thrilled that powwows, like much of the rest of the country, will be reopening soon. So I'll be out there dancing on Saturday. I'm a community member as well as a social worker. So I always try and be that bridge between who I am as a cultural being and who I am as a professional. I do a lot of writing. I do a lot of presentations because I want my chosen profession. I want social workers and other helping professionals to be good at serving Indigenous peoples in respectful, competent ways. And I build on the work of people who have come before me. I'm part of the Indigenous and Tribal Social Work Educators Association, as are many people like Eddie Brown, who has written a lot on Tribal TANF programs. Some of you from my generation may remember that he was former Assistant Secretary of the Interior, head of the BIA. He was a social worker and very committed to Tribal TANF, very important issues. Next slide, please. So I'm the readiness speaker, but then I pose this question, what does it really mean to be ready? It's kind of a philosophical question. These are uncertain times. It's hard for us to know what is around the corner. I don't think we really predicted the pandemic. I don't think we fully understand the implications of the pandemic. So it's a little tricky to think about what it means to be ready. But yet that's something that we're all trying to grapple with. And we're helping our customers to grapple with this as well. How can you be ready in these uncertain times? Next slide, please. We're coming out of a pandemic, so they tell us, but it's not over. The world is changed for all of us. We can't just say, oh, pandemic over, done. Our lives have been upended, and that doesn't go away. There's a push to get back to work, and we're all experiencing this. I experienced this in my university. Okay, we're not doing online learning anymore. We're back in the classroom, go, we're all fine. We're not all fine. A lot of people, professors, as well as students, were struggling with this. We're all kind of in the same boat, figuring out how to move forward. It's important to acknowledge the transitions inherent in returning to work. And many of the people that I've looked to as leaders have not necessarily done that. And that's problematic. We need to recognize that for each one of us, not just our customers, not just our students, not just the people that we're trying to support, but for each and every one of us, this is a big transition, and we need people to acknowledge that. Next slide, please. We need to find the strength to move forward. And something that worked for me is really listening to what elders and what traditional people were saying. At times when I was feeling really, really lost, there were some really good creative people creating webinars saying, let's get Indigenous people around the world together. Let's get our public health professionals together. Let's get people together and talk about what we're feeling and what we're experiencing. And one thing that I heard elders say is, this is not our first pandemic. Well, it felt like it for me. But as Indigenous people, we have survived before. And, I heard people talking about what they had heard from their parents and grandparents about the flu pandemic of 1918 that hit tribal communities really, really hard. And in fact, I believe the first non-military outbreak of what they came to call the Spanish flu happened at boarding schools where Native people were and where disease was easily transmitted. So people have experience with this, not just the experience of being devastated, but the experience of resilience. And the message that I was hearing is, we will not let this stop us. We will move forward. Next slide, please. I think the challenge for those of you working in Tribal TANF and the new program is how do we help people move from being stuck to a productive pause? It is perfectly natural for some people to feel immobilized. So we need to acknowledge that. And when we had the poll just a few minutes ago about what sort of support do we need to give to our customers, in addition to donuts, which was very, very important, there were things like understanding and acknowledging. So that's our starting point, acknowledging that people may feel immobilized and may be reluctant to go back to work. Reluctant isn't even a strong enough word. People may be really feeling paralyzed, fearful. So we need to acknowledge that that's natural, that's normal. It is important to take time to reevaluate our priorities. People are saying, oh, you know what? I've lost people to COVID. Family's important. I don't know if I want to go back to life before the pandemic. I need to reevaluate my priorities. But what we need to do is think of that as only part of the process. We don't want to get stuck in reevaluating the priorities. Priorities are about moving forward. So what I suggest to those of you in Tribal TANF in the new program, listen to this message, believe this message, share this message, and help facilitate this process of people moving forward. Helping our customers re-examine may be a little bit different than what you've done before. It may not be typical work for all of you, but I think it's necessary for each and every one of us. If we're pretending that these barriers to work are not there, that's not helpful. Then we're part of the problem if we're ignoring the barriers that are stopping people from getting back to work. It must be acknowledged. It's not necessary to have all the answers. None of us has all the answers. But we got to go through that process. Next slide, please. Believing in what you do is really important. And I think that's certainly one of my takeaways from the pandemic. We're reminded that no day is promised. Life can be uncertain. People who were with us a few months ago may not be with us next week. Everything that we thought we knew could be changed, could be upended. That can feed into the reluctance to work if we don't see work as something meaningful, if we don't integrate that as part of a holistic picture of this is what's important to me. So if work is just menial, if it's make work, if it's just, I got to do it because that's the rule for the program, you're going to have trouble getting people to want to go back to work. And if they go back, they might be kind of grudging about it. But there's a flip side to that. If you're thinking that, the pandemic reminded us no day is promised, you might be able to leverage that to fuel a passion for meaningful work. If no day is promised, then I need to get out there and do something to make a difference because work is important. So what I'm encouraging you to do is think about how we frame or reframe work, because we must reframe it as something meaningful. Next slide, please. So in the United States, work is often taken as just central to identity. So when people are introducing themselves, they will introduce themselves according to their career. I'm a teacher, I'm a nurse. People defining themselves by what they do. So what they do is what they are. And if you're in school, then it's, what's your major? That's how you introduce yourself to a new person. It's a little bit different in many Indigenous cultures. So work is not necessarily central to identity. What is central to identity is, who are your relatives? Where are you from? So it's that being in relation with people. Your challenge is to bridge this gap. In working with Indigenous people, how can you communicate what is central to identity? Next slide, please. This, I think, is really the meat of what I want to say. Reframe work as a meaningful part of identity. And that can be a little bit tough depending on the sort of jobs that you're sending people to do. Certainly TANF originally was not necessarily promoted as a meaningful career sort of work. It was more of a make work program, but that's not the only way to look at it. And so when you're working with your clients, you can frame this as meaningful. Because if you're working, you can say, you know, I am a provider for my family. I am the one who keeps the stories. I am the one who passes on knowledge. Now, this could be a way of jobs that some people might see as very entry level. I don't know, maybe you're working at the library as some sort of assistant. That can be keeping the stories. Maybe a teacher's aide is somebody who's passing on the knowledge. If somebody can say, I am the one who makes sure the elders are fed, maybe that's some sort of entry-level food pantry job. It's not necessarily a highly skilled career, but boy, is that meaningful. If someone can say, I am the one who makes sure the place where the children learn and play is clean and safe, there's a lot of power in that. On the other hand, we could say, well, that's, you know, you're working as the cleaner, as the janitor. Yeah, but I'm doing it at the school and the kids are going to have a good, clean, safe place. Or I am the one who will make sure that the road is smooth so that people can travel safely. Maybe it's some sort of entry-level construction, filling the potholes. That's really important on those reservation roads. I want those potholes filled. If you frame the work roles in terms of relationships, in terms of responsibility, in terms of caring for others, I think that that message is more likely to be heard because it is about relationships and caring for others. Next slide, please. So how do we move forward from the pandemic? You know, you can tell my mind frame as I was putting together this PowerPoint. If you know, please tell me. Another way of saying that is, you know, we're all in this same boat. These are uncertain times. We don't know. Let's acknowledge that. There is a disconnect if we're asking customers, get back to work.
Slide up and to the right. Do you see it? Hover over that.
Okay, I'm going to continue, and I think I heard somebody else, but I believe I've got 5 more minutes. So don't fall into that disconnect. Don't just tell your customer, oh, get back to work. Like, it's simple. Acknowledge that, you know, there are challenges. And again, that doesn't mean that we don't move forward. It doesn't mean that we get stuck. Sometimes when things are really difficult, the best we can do is put one foot in front of the other, and that's okay. If you're putting one foot in front of the other, you are making incremental progress. So you look back a month later and you think, wow, I am in a different space than I was a month ago. Some people turn to traditional guidance and support, as I did. And one of the messages that I heard that really resonated with me was a teaching about blackberries and thorns. And that's why I put that picture there of the blackberries. Blackberries are an important medicine in some tribal traditions. But it's not just about the medicine. It's not just about what is sweet and affirming. Blackberries have thorns. Life has difficulties. The pandemic has difficulties. There is a duality in many indigenous traditions, and we recognize that. So if all we see are the thorns of the pandemic, then we're going to miss the sweetness of the blackberries. It is both. We need to see the whole picture. We will not allow challenges to define us. We're not going to get stuck in the pandemic. We're not going to get stuck with the thorns. Resilience and perseverance have defined indigenous populations. Sometimes we need some reminders of that. Reminders for ourselves, reminders for our customers. Next slide, please. And as I wrap up, we can't pretend that nothing has happened. So don't pretend that with your customers. Don't pretend that with yourselves. If your supervisors are giving you that message, don't buy into that, because things have happened. Things have changed. It's important to acknowledge our feelings, our experiences, our fears. These are real. It's not the whole story. Reach for the hopes, reach for the future. Help your customers to do that as well. Draw on the supports that are meaningful for us. Sometimes it's culture, sometimes it's tradition, sometimes it's spirituality. It may be something different for the person that you're working with or for you. Figure out what is meaningful and reach for that. Reframe how we think about work and how it fits in our lives and aligns with our identity. Because it's so easy for people to say, TANF programs, it's menial. Not necessarily. Work can be so meaningful rather than menial. You just need to look at it that way. Yeah, the glass can be half full or half empty. We have choices in how we frame things. Recognize and tend to our own needs, because each one of us, it's tough to go back to work. The world is not as it was 3 years ago. Attend to the compass so that we know we're headed in that right direction. Sometimes it's just about putting one foot in front of the other. Be aware of those thorns, be aware of the difficulties, but keep reaching for those blackberries. And I'm going to wrap up there. Thank you very much.
Thank you. We'll now hear from Dr. Fergus.
Hi, thanks, Keisha. Hi, good morning or good afternoon, everyone. My name is Fergus, and as Keisha had mentioned earlier, I am with the Office of Child Care. Today, we'd like to just share with you some of the highlights and some of the strategies regarding collaboration and coordination between TANF as well as child care, and also sharing with you some of the resources and some of the funding flexibilities of some of the increases in funding that has been made available to tribal Ccdf lead agencies to help to support both the return to work or maintaining work, as well as addressing some of the workforce shortages regarding childcare. And as part of that is in order to maintain a high level of quality childcare. I did just want to offer that I am currently transitioning from a regional assignment of 20 years within Region 6 to working with our central office as a senior tribal childcare specialist. And part of that is OCC's overall commitment to building capacity and enhancing our tribal support to address all of the specific needs, as well as the increased needs for technical assistance and resources for our tribal CCDF grantees, which can in turn provide greater partnerships with Tribal TANF, Tribal New, and many of the other supporting programs. I currently work in a central office position, but my heart and my home is within Region 6. So I'm very happy to be here with you all and to share some of this information. Okay. Next slide, please. CCDF and TANF lead agencies have a broad discretion to design their programs. They can work together to create a common vision for aligning the program structures, the policies, reporting, access to services, and resources to meet the needs of the families and the children. Overall, some of those 4 key areas of meeting the needs of collaboration or collaborating to meet the needs of the families are to improve the economic well-being of the low-income families that you're currently working with, to also move towards improving and maintaining the overall quality of childcare, providing access to childcare so that the parents can work and or attend school or other trainings, as well as helping families to achieve long-term financial independence. I'll offer a couple of strategies of some innovative practices now, and then I'll end with sharing some more specific, but just to, again, kind of go along with how do we rebound, how do we persevere and have our resiliency in both our personal self-care, as well as providing that type of support to the children and families that we're currently serving. You may want to consider if your organizational structure for CCDF and TANF provides the most effective and efficient ways for delivering services, or if there may need to be any modifications to the way that you are currently approaching that or offering those types of services in light of the pandemic and some of the changing needs, both for your program as well as for the children and families that are receiving your services. Also looking at evaluating the current rules that the lead agencies, both within the state as well as the tribal programs, look at any of the flexibilities and how that offers opportunities to collaborate. And then also looking at creating a co-designed CCDF and TANF program so that it's child-centered and parent-centered, and you work as a team to help to develop the support needed for those families. Next slide, please. Okay. This slide is more of an informational slide, and it can be accessed on the Office of Child Care website. But as you can see, there's many moving parts to understanding the multiple funding that was available and increased during fiscal year 20 and 21, both during the start of the pandemic as well as throughout the pandemic. There's 4 different CCDF funding streams that were released to the CCDF lead agencies. One, which was released in 2020, is the CARES Act. The other 3, which were released in 2021, are the HRSA Act and ARP Act. This handout or this slide is available on our website, and it explains all of the relief funding streams as an overview that can be shared with your CCDF leadership, your TANF leadership, tribal leadership, as well as your fiscal department staff. Next slide. One of the priorities of the ARP Act discretionary supplemental funds is to expand access for child care assistance. There is an information memorandum that indicates that there are 3 activities that prioritize equal access. One is supporting families who are struggling to afford childcare or facing job interruptions or income loss. The second is for childcare assistance for essential workers. And then the third is data system support to support equitable access. So I wanted to highlight just a few activities under each of those categories. So some ways to help and support families is to offer either a waived or reduced parent copayment for their support for childcare. The other is to broaden the definition of what your qualifying activities would be. And then another would be to update policies to reflect what currently is happening within the labor force. The next, regarding childcare assistance to essential workers and frontline workers. We know that we heard that throughout, and we've sometimes identified it as medical or education, but then over time, those definitions broaden to everyone from store clerks to city officials to help to maintain and to also continue offering services available to the communities. So we have some very broad definitions of essential workers, and that is also defined by each tribal lead agency. So some of the ways to help to support that is that, as I mentioned, it's not just limited to the public health emergency, but the lead agency staff should prioritize that essential workers have incomes that are below 85% of the state median income. And also that part of the data systems that are there to support equitable access is to more or less modernize or maintain current data systems, to consider upgrades and improvements in order to access information, to share information, and then looking at the policies to determine if the resources that are being distributed are equitable for the families. And then this upgrade can also offer an opportunity to review to see the effectiveness of the services that are being provided in real time. Next slide, please. Another of the funds that I wanted to also quickly highlight was the ARP Supplemental Discretionary. These are an unprecedented opportunity to expand access to high quality childcare and to move forward and to move towards a more equitable childcare system. The system should meet the developmental needs of the children, should provide parents with the true choice and equal access to childcare, and also looking at what best suits the family's needs. And it should also appropriately compensate an essential and skilled workforce, as well as facilitate a robust childcare sector. So within childcare, we have really broadened our scope of not only providing childcare services to help families to maintain employment, but then also to increase the supply of childcare by helping to promote and support the childcare industry. We've seen that, unfortunately, childcare was one of the most needed services during the pandemic, but there was an underutilization due to closures and just, as mentioned earlier, just the uncertainty over what was allowable, what could be offered, and what was essentially safe for families. And so in turn, what we've seen is there has been a drastic decrease in the childcare workforce. Next slide, please. I wanted to highlight just a few innovative practices used by a tribal lead agency, as well as coordination with their tribal TANF, of looking at integrating services to provide and support self-sufficiency. They looked at anchoring services, the material supports, and the resources in a protective factor. So that way it is multi-generational. They want to look at and understand the individual's priorities and then the needs and strengths of the family within a holistic context. They also look at integrating the service delivery across programs to mobilize real-time and timely access to the various opportunities. And then looking at monitoring and tracking mutual data sources, so they can look at what is being delivered and what are those outcomes and how it's how it responds to changing needs over the time. And that goes back to the first slide of looking at those 4 key areas on how TANF and childcare can collaborate to meet holistically those needs of those families that you're currently serving. I shared a couple of examples during that slide, and I also wanted to just maybe highlight just a couple of other strategies. Looking at establishing procedures for the families to move seamlessly between TANF and childcare, looking at aligning eligibility policies, implementing policies that allow children to be cared for in regulated childcare and to receive TANF childcare payments during temporary interruptions in the parent's education, training, or employment. Another is to look at establishing a uniform childcare payment rate that supports access to a full range of childcare providers. And then importantly too is coordinating consumer outreach and education to develop a coordinated consumer approach for engaging the low-income families or the vulnerable populations. And then part of that is to update your current consumer education websites, call centers, and ensuring that you have the most current information available. Next slide, please. Office of Child Care Technical Assistance site services has been frantically addressing many of the questions, the flexibilities, and information resources of updating those to ensure that you have the most current information available. These are new. At the time that this was developed, they were hot off the press resources, but they currently have briefs or one-pagers to look at frequently asked questions to provide simple information on both spending requirements and flexibilities for our various COVID supplemental funding. And you can access any of these on the OCC website or reach out to your regional office. Next slide, please. This is our wealth of information within our technical assistance site. We are currently being assisted through our Tribal Childcare Capacity Building Center. And this is kind of your one-stop shop of all information related to tribal childcare. So we encourage you to reach out to access all of the information available. This provides information for providers, for families, for policy makers, as well as health and safety information and resources, both for the administration of your program, the response to COVID-19, and then also the COVID-19 recovery, and then the flexibilities for our program and the increased level of funding. That is the information that I wanted to share with you from the Office of Child Care. So please reach out. And if you have any questions, please feel free to enter them in the chat or be in contact with any of our regional offices. Thank you.
Thank you. Next, we will hear from Captain Hurd.
Thank you so much for giving me the opportunity to speak with you today. Go ahead and go to the next slide, please. So I represent the Office of Tribal Affairs and Policy at SAMHSA, and our office is really the primary connector for tribes, tribal organizations, or other partners working with tribal nations and tribal citizens. We are also the lead coordinator for the Indian Alcohol and Substance Abuse efforts, or IASA, leading the coordination of the Tribal Law and Order Act activities. Go ahead and go to the next slide, please. So SAMHSA's mission is to reduce the impact of substance use and mental illness on America's communities. We believe that behavioral health really is a national priority and that behavioral health is essential to health. We believe that prevention works, that intervention is critical, that treatment can be effective and people can and do recover. As a clinical social worker, I've had the honor of walking alongside people in their recovery journey, and I've seen families come back together, children come back to their families, and people able to go on their life journey in a healthy way. Go ahead and go to the next slide, please. So we know that the impact of COVID on American Indian and Alaska Natives has been disproportionate. We've had much loss, much grief in our tribal communities. SAMHSA allows me to serve from my home in Oklahoma, the Choctaw Nation, and being here from through the pandemic, I've seen loss of our elders, and with that loss of some of our language, I've also seen a huge impact on our youth, and so we have a lot kind of to sort out in the coming months and years. Go ahead and go to the next slide, please. So after nearly 2.5 years of COVID-19, becoming widespread globally, we've seen over 1 million people in the US have died and from the virus, and around 90 million cases reported. Though all have been impacted by COVID-19, the pandemic has taken a huge toll on our public health workers and healthcare providers, on our tribal workers. We've seen a lot of stress and burnout. I've seen my friends, working tribal healthcare and other tribal programs, Head Start, still going to work every day, being there for the patients and the families that they serve, while also losing family members and losing friends to COVID. Among vulnerable populations most heavily impacted have been our Indigenous people, with infection rates over 3.5 times higher than non-Hispanic whites, over 4 times likelier to be hospitalized to the virus, and have reported higher rates of mortality. And this is despite, higher rates of vaccination as well. Go ahead and go to the next slide, please. Additionally, we know, that historical trauma and continuing racial inequity has contributed to these disparities, as well as socioeconomic factors seen with our Indigenous populations. We also know that spanning several years, American Indian and Alaska Natives have experienced things like food insecurity, poverty, and poor housing conditions, and still having difficulty accessing quality healthcare. And that's a challenge for those citizens and members living both on and off reservations. We know that the pandemic has intensified these inequalities as well, stemming from these issues. And we also know that we've experienced markedly higher rates of COVID-19 mortality compared with other and racial ethnic groups. And kind of, if you think about that in context, losing our elders are really kind of losing those folks that hold our language, our cultural wisdom. And, many tribes have been, really struggling to keep their language alive, and, losing those elders is just an amazingly huge kind of blow to those tribal nations. Go ahead and go to the next slide, please. So in response, SAMHSA has developed some resources to help support in kind of addressing some of these issues. Very early on in the pandemic, I believe this is the right number, and I'm sorry if I misspoke, but telehealth for IHS only comprised about 1% of the visits. very rapidly. Indian Health Service and other tribes that are self-governance tribes that run their own healthcare pivoted to telehealth. And I believe now telehealth is representing about 40% of visits IHS-wide. When you think about the huge lift for this, that this took, many programs that start their telehealth programs take years to stand up their programs, and tribal programs did this like very quickly. Also on this site has different resources that you might find helpful for those that you serve, such as handouts about dealing with stress, dealing with returning to work, dealing with anxiety that your kiddos might feel returning to school or daycare. So there's a lot of good resources that you can find in a one-stop shop on this page. Go ahead and go to the next slide, please. Next slide, please. So SAMHSA supports many technical assistance resources, but one of the ones that I thought that you might find very helpful is the American Indian Alaska Native Technology Transfer Center, or TTCs. We support TTCs for prevention, addiction, and mental health. But there's some really great resources here related to return to work, related to dealing with stress and anxiety, and also with helping children with these issues as well. Go ahead and go to the next slide, please. Additionally, so we have specific American Indian Alaska Native Technology Transfer Centers, but then we also have larger networks regionally of MHTTCs. And this will get you to a really great resource that I think might be helpful related to addressing some of the mental health concerns related to COVID. Go ahead and go to the next slide, please. Additionally, this is a guide for supporting student and staff mental health toolkit. It's available. It's the MHTTC, one of the MHTTC resources that I think is the most applicable. It's designed to help guide trauma-informed, equitable, and compassionate kind of conversations to providing mental health supports to schools. Go ahead and go to the next slide, please. Also, some resources on the ATTC website. Next slide, please. Also, the PTTC, or the Prevention Technology resource that I mentioned. Next slide, please. Also, our SMI advisor has some resources how to talk about vaccine, if there's interest in that, as well as other coronavirus resources at the SMI advisor site. And this is also a SAMHSA supported technical assistance resource. Go ahead and go to the next slide, please. We also have a National Center of Excellence for Eating Disorders, and I found that the pandemic has really exacerbated some of mental health conditions, particularly with youth and young adults, and this is a great resource relating to eating disorder. Indian country, we don't have robust resources related to eating disorder treatment, and I think this can be very helpful in giving you some guidance if any of the clients that you're serving might be dealing with an eating disorder. Go ahead and go to the next slide, please. Additionally, the Opioid Response Network, we have seen, unfortunately, along with COVID-19, an increase in drug overdoses, mostly fueled by illicit fentanyl in the supply. The Opioid Response Network has just like a plethora of resources. Also, if you're like dealing specifically with issues related to opioids, maybe standing between a client that you're serving being successful, the ORN can be helpful with these resources as well. Go ahead and go to the next slide, please. We also have the disaster distress helpline that can be called if someone is in need of immediate crisis counseling or referral. The 988 number is also optional, the National Suicide Crisis Lifeline, or 988. Folks can call that if they are in a mental health or substance use crisis. You can also call that number too if you encounter a client that is in crisis and you don't know what to do. You can call the 988 number and they can guide you through that. Go ahead and go to the next slide, please. Here's the 988 slide. So on July 16th, we transitioned that 1-800-273-TALK number that we have really trusted for several years to this 3-digit number to access support for a mental health or substance use crisis. Go ahead and go to the next slide, please. Next slide. These are just kind of a set of resources that I put together that I thought could be helpful, and all of these links in their presentation are live. There's a tip sheet here which provides resources that can be utilized to support someone that might be in need of assistance for mental health or substance use disorder, as well as an intimate partner violence and child abuse considerations during COVID. Go ahead and go to the next slide. Next slide. This is also a fact sheet that I think might be helpful about managing stress. Additionally with COVID, we've had mass violence, we've had other kinds of traumas that have happened. We've also had the focus lens on the federal Indian boarding schools and the trauma that happened there. So there's a lot of kind of coinciding trauma that are impacting tribal citizens. So managing stress and being able to recognize that, I think is very important. Go ahead and go to the next slide, please. This is also a good handout, coping with stress during infectious disease outbreaks. Next slide, please. Additionally, tips for caregiver, parents, and teachers during outbreaks. You could just print these off and share these with your clients if you think they may be helpful. Go ahead and go to the next slide, please. Additionally, this is another tip sheet about social distancing, quarantine, and isolation. We're talking about being at the end of the pandemic, and unfortunately this week I've had COVID. So I think, we're still needing to talk about some of these things such as social distancing and quarantine and isolation, unfortunately. Go ahead and go to the next slide, please. This is talking with your children, and oftentimes, kids going back to school may have concerns. And so this is helpful in because really, we're talking about similar things like as dealing with a traumatic event or disaster. Go to the next slide, please. Just another tip sheet. Next slide. I want to be cognizant of my time. Oh, and I'm here. So I wanted to share my email address. That's my mobile phone number. If you have a need for additional resources, or you just maybe want to talk through a situation that you might have, and I could suggest additional resources, please feel free to reach out to me. Our office is really kind of charged with being able to make those connections. So we stand ready to support you. Much like Lisa, I reside within Region 6, and Region 6 is my home, and I stand ready to support it in any way. So thank you again for the opportunity to share.
Thank you so much, Dr. Hurd, and to our other speakers as well. I do want everyone to know to please pay attention to the chat box. Jesse has put in a lot of the links to the resources that Captain Hurd just shared with us. So if you weren't able to gather some of those, please feel free to check the chat box, and you should be able to pull those links up. Let's see, we're looking for questions. Please, if you have questions, put them into the chat box. If you are on the phone, feel free to take yourself off of mute as well, if you have a question for any of our three speakers. So one question is for Dr. Fergus. Can you share any suggestions regarding childcare and TANF co-designing services? One of my thoughts and ideas was especially around the activities. Could those activities match up to some of the TANF work activities? Any thoughts or ideas?
Hi, Keisha, and I'm not going to show my video, but I am here on audio. I'm having some challenges, but I'm back. Yes, that would definitely be some of the definitions of what qualifies families for childcare and TANF, and aligning those, because CCDF has offered some great flexibilities with some of the definitions, also expanding beyond the 12-month minimum eligibility requirements. So to provide more long-term services, also aligning some of your application processes, whether it might be that you are having the families to apply online, to also limit the redetermination check-ins of like every 6 months, to have, like once they've been determined eligible, that they would remain eligible unless maybe they personally request that they no longer need services, or they exceed some of those income guidelines or some of those. So those would be just some real quick procedural changes, but then some more of the like technology advancements and the database and some of the data resources can help to really enhance maybe some paper application processes that you have in place, or a need for a family to come in, or for you to be able to track to see if this is beneficial, and for you to really see like maybe there's families that are not being served, or there's another age group of children that are needing to be served, So it really, I think it's just helping to really assess the need, as well as making it very simple for families, and as well as convenient for families to apply for the services.
Great, thank you. A question for Captain Hertz. So the new hotline number, is it just 988? That's all that needs to be dialed?
Yes, exactly. And there should also be text capabilities, and depending on where you are, chat capabilities. So we know that a lot of our young people really like to text more than call. And so we've been working hard to be able to increase our ability to respond to text as well. But yes, just 988. You'll be asked if you're a veteran, and if you're a veteran, you can press 1. If you are Spanish speaking, you can press 2, and then you'll be linked to either a local call center if someone is available, or if not, the national center. And then a trained mental health counselor will speak with you and give you guidance, and if needed, refer you to care. So.
Excellent, thank you. I like the thought of being able to text. Everyone texts these days. My grandmother used to try to text, so she was 90 years old. So that's wonderful for that to be an option and to make it a lot easier. Thank you. Dr. Weaver, for customers who are afraid to get back to work in person in the workplace, I think it was a great point of making work meaningful, because that really is how we survive in creating careers and in working for so many years of your adult life. Do you have any suggestions, though, for those that are fearful, especially in relation to the pandemic, knowing that we still are not out of it? Any suggestions on how to help individuals address those fears?
The first thing that you need to do is listen. You need to be able to hear from the customer, what is the root of the fear? Because we might have our assumptions about what they're worried about, what they're afraid of, and we could be completely wrong. So I wouldn't go too far in planning on how do you handle this until you hear from the client. And just even that respectful listening will go a long way. Listen to them about what they're concerned about. Be in dialogue with them, strategize with them on how to move through it, but you really can't do too much until you know precisely what they're afraid of.
Thank you. And I know in one of the early poll questions, that was definitely something that I think individuals put on there, is to be heard. And to listen, along with that empathy and understanding. So I thank you. I think that that does go a long way. And I think there is definitely that way, a way for us to be able to implement that into the daily work that we do, particularly with the work that we have with the customers that we serve. Thank you. Another question then for Captain Hurd is any advice you have about sharing information between rehab services and Tribal TANF, especially for our customers who maybe have underdiagnosed disabilities or who may have some be undertreated?
And so I'm trying to understand exactly the about share information to care. I'm not really understanding. My apologies.
Someone who asked that question, can you provide us with more information on that?
Keisha, this is Jessie. My guess is that question might have come up because of some conversations in some of the breakout rooms yesterday, where folks talked about, struggling to share information to best support customers who might have a disability in some way, with like rehabilitative services and or mental health service programs that they are getting services from, and just not having that information sharing agreements in place in order to effectively coordinate. And I think just looking probably for your suggestions around ways to help streamline that coordination of information sharing.
Sure.
Okay, yes, I do understand. And we also struggle with this for people with substance use disorder, and being able to share that information related to limitations that we have with 42 CFR Part 2. I'm going to put a resource, I believe, that might be helpful in the chat. We have a program called SOAR that specifically addresses some of these issues and connecting people to care and resources. Let me find it and I will put it in the chat because I think this might be helpful.
Excellent, thank you.
It's our SSI SSDI outreach, access, and recovery, and it really has some helpful tools that I think might be good to address this question.
Thank you. Let's see, we have a couple of more minutes. If anybody else has any questions, please feel free to put them into the chat. Let's see here. Okay, so this one I think is probably for Dr. Weaver again. And this is actually dealing on the other side of the work. So some programs may have staff that are afraid to get back to what normal is or what it's supposed to be or used to be. Do you have any advice, or does your same advice also apply to like their supervisors? Or is there anything additional you can suggest or give us to help with those of us who work with the public be able to get back to work?
Absolutely. Yes, I think the same advice applies, maybe even more so, because I think that some of the supervisors that I've had, some of the leaders that I have seen, have failed to acknowledge that we are all struggling, have basically said, get back out there, do it. Some people from my generation may remember Nancy Reagan saying, just say no to drugs. That doesn't really help. It doesn't really get you very far. I think that we do need our supervisors, our leaders to acknowledge that each and every one of us is struggling. We are all related. We are all connected. We are all in this pandemic. And I do think that it's a failure of leadership if they are telling us to tell our customers, just jump in there and do it, get back to work. So we all need to listen to this same message. We all need to acknowledge that this is a struggle. This is life-changing. And if your supervisors and your leaders aren't really acknowledging the difficulties that you are struggling with, at least acknowledge that for yourself. Validate yourself. You know, this is not a normal world, and I am trying to function anyway. So take the time to be gentle with yourself, affirm yourself. Your concerns are real. But again, don't get stuck there. Motivate yourself to move forward, because the world is continuing. It is changed, but that's not a reason to get stuck. So some of this we may need to do for ourselves. And please, if you're a supervisor, I hope that you're listening, because pass on this message and validate the people that you are supervising, so that they can be whole and healthy and recognized and understood as well, so that they can pass this on to the customers. We're all in this together.
Excellent, thank you. Yeah, self-care, I think, is a must. And I think we often forget, especially in this line of work, we often forget to make sure that we take care of ourselves, because we're worried about taking care of others. But if we're not taken care of, then we're not in a position to be able to care for others. So absolutely, thank you so much. I think we could take maybe just a few more minutes real quick. There has been a lot of information shared today, and we thank you all so much. So I will ask for each one of you, what is one tip, one suggestion or thought that you would like to leave with those on the call today? One thing that you want them to just take home and to remember. And I'll just open it up for whoever wants to go first.
Keisha, it's Lisa Burgess, and I would just like to share related to the self-care that you really need to take care of yourself personally and the needs of you and your family, as well as to be able to support those that you're currently working with. And also something that's continued to be shared throughout our discussion this morning is just to listen to what the needs are, to modify, to be flexible. And I use that term very broadly, but to be flexible in all aspects. But I think it would just be the two basic things of the self-care, as well as listening, and just room for modifying, as well as being flexible with your programs and with just life in general.
And I'll jump back in. I would say the phrase resilience in relationship. That, yeah, it's not our first pandemic. We will get through this. We need to recognize how difficult it is, but that resilience when we reach out to others, reach out to your colleagues, your family members, your supervisors, because you don't have to do this all by yourself. We encourage our customers to reach out to us so that we can provide that support for them. We should also have permission to reach out for support, because I think we're stronger when we're together, and we are all related. Support others, accept the support yourself, and experience that resilience in relationship.
I'll just add, I don't think I can say it any better than my co-panelists, but just treating ourselves and others with compassion, kindness, humility. And with that, we're going to get through this.
Wonderful. Yes, I think it can't be said better. We need each other. There was always the old saying that it takes a village to raise a child. I believe the village doesn't stop just because you become an adult. You become part of the village, and you are the village, and it takes us all together to get through life. Thank you all so much for being on our panel today. Thank you so much for the wisdom and the words and the ideas and the suggestions. We really greatly appreciate it. Thank you again for everyone who joined in. I think I am now supposed to turn it over to Jessie.
Hi, everyone. I'm back. And what that means is we're about to go somewhere. We are going to transition. I just want to reiterate the thanks to Hillary and Karen and Lisa and Keisha for a really wonderful session that just ended. It was both inspiring and just chock full of information. And as you might have seen in the chat box, the slides were put in there so that you can also access some of the resources, so many of the resources that were shared both by the Office of Child Care and SAMHSA. It is about 11:55 Eastern time. So we are going to be moving into our next session. As you might recall from what John said when we started our meeting today, but also how we structured yesterday, we just had an opportunity to learn about our topic of the day, which is really around support services, those services that help enable us and customers to engage in work. We just learned about it. Now is the time that we're going to have to discuss. And again, we're going to have 2 breakout rooms this time, and I'll share the logistics of that in a moment. But this is truly that time and opportunity for that informal exchange and conversation to take some of what you've learned today and talk about it, but also talk about some of the promising and innovative strategies that you are doing in your programs or challenges that you're facing, and gather feedback and suggestions from your peers. Again, this next session, like yesterday, will not be recorded. We will have one note taker in each room, but they will not be recording anything that anyone says, in the sense that nothing will be attributed to any program or person, just capturing some high-level takeaways. We really want to create this space and time for you to connect and to discuss both what you've heard and what you've been doing in your own programs. From a logistics standpoint, we will be in these breakout rooms until 12:35 Eastern, 11:35 Central, 10:35, yes, 10:35 Mountain. So about 35 minutes, I'd say. And after that, immediately after this opportunity for exchange, we will have a 25-minute break. And then after that, we will come back together at 1, 12, or 11, depending on where you are, for another opportunity to create something together, another activity like we had yesterday. So go to the next slide. What we're going to do is have 2 breakout sessions at this point. One is going to be for Tribal TANF, as you can see, so that will pop up, or new programs. So if obviously you're a Tribal TANF representative, I would join that room. If you're a new program representative, join that room. If you happen to be both, again, there's an opportunity to choose which room you would like to be in. And if you have more than one person present from your program, now would be a good time to huddle and figure out if you want to divide between the 2 of you or both go into the same room. These rooms will be led like they were yesterday by Tribal TANF and new program leaders who will share a little bit about some of the work they're doing, as well as open up for discussion and conversation. So if for some reason, like I said yesterday, if this breakout menu does not appear in a moment on your screens, please feel free to use the chat box to engage with tech so that you can go into the right room. Again, the 2 rooms will be Tribal TANF breakout room or new program. Let's have that appear now so that folks can go into the next session. And it just appeared for me, join a breakout room. So hopefully you're seeing that as well. See you guys soon.
Smith family, Keisha and her brother Corey, who I always looked up to. He is a great athlete. Keisha was a great athlete. I want to thank you all for giving me the opportunity to be a part of this. Big shout out to ACF, Tribal TANF. It's been a true honor to serve in Indian country and work with you all along the way. I know the last time that we kind of had a planning meeting, I was up in Red Lake, Minnesota, and I believe I had a Minnesota Vikings pullover on, and I was up here doing some work in Red Lake. Well, today, I was able to move my flight back to make sure that I had good Wi-Fi to be with y'all here today. I'm actually up in Shakopee. Some of y'all know where that is, out here in Prior Lake here in Minnesota. And before I jump on my flight, I had made sure that I had a good location to do my address. So I'm not from Minnesota. I'm just a big Viking fan. But I'm not from Minnesota. It seems like the both times that we got on, I was up in Minnesota. I actually might make my home in Dallas, Texas, and you know, with my wife and our 7 children. What I do, I do several things. One, I've had the opportunity to travel around as a motivational speaker, work with different tribes as a speaker, as a consultant, and I just got into this new gig called acting. I just finished up my first film last summer, where I played a gentleman by the name of Bill Stepson, who you know, doesn't make it in the movie, but that's okay. And then I also just finished up a TV series called Panhandle. Well, I don't know if that's supposed to come out or not, but anyway, and that one I play a guy named Mighty Manford. So trying to make it, trying to do it. I know when the pandemic hit, we all kind of scattered a little bit, habits changed, had to rebuild habits, you know, coming off of the pandemic. Some of us got into some really cool things. Some of us let go of some things, and we're trying to get them back, or we're glad that we let them go. One of my things was acting, and I'm very grateful for it. I've relocated to Dallas to be closer to my representative and to be closer to the airport, so I could fly out and be where everybody needs me on set whenever it may be. Now, I build that up, and I tell you all that for this very reason, right? We have to continue to get outside of our comfort zones to put ourselves in a position into a better place to continue to make an impact. You know, like Keisha said, you know, we've known each other our whole life. So when I was a little guy, you know, my grades weren't that great in high school. And I remember there were teachers that, you know, expected me to fail. And there was teachers that wanted me to fail. At the end of the day, the bottom line is you've got to be who you are, and you got to accomplish what you want to accomplish, because there's nobody out there, there's no bus out there that's going to come by and pick you up and say, hey, you want to go be successful. Now, I know that I'm preaching to the choir, and I know what I'm sharing, you already know this, but sometimes, man, we just need to be reminded, you know, for, you know, in the cause of what we're doing. So that's one thing I just want to encourage to you is, regardless of who expects you to fail, regardless of who may not want you to be successful, just know, man, this is your game plan. This is your avenue. This is your lane. This is your world. So go get it. Go make the best of it. Keep making a difference. Keep making an impact. It always seems like when you're average and you're normal, a lot of people don't mess with you. A lot of people don't really, you know, get in your lane too much. But the moment you want to make an impact, the moment that you want to make a difference, the moment that you want to inspire, it always kind of seems like the criticism starts coming around, or the, you know, the opposition shows up. But you are who you are. And I want you every single day, man, to wake up and to be one of a kind. And that's one thing that I love about, you know, my outreach. And everybody in here, same thing with you. Same thing with you, is you should love being one of a kind, and you should love your outreach, and you should love what you get to do and who you get to serve. I was just in the talk here a little bit ago, and one of the presenters was talking about, you know, then I have to go here, then I got to go there, you know, and I know sometimes you as professionals, you may say that too as well sometimes, because I've been taught this, you know, we don't have to go make an impact. We get to go make an impact. We get to go be one of a kind. We get to go and explore opportunities and learn new things. and a lot of people here, like as a consultant, I had the opportunity to come to Minneapolis for 2 days, and there may be a lot of people that say, how did he get to do that, or why does he get to do that, or who would ever thunk that he got to go do that? I always did. I always knew. And there's so many clients out there that we serve. There's so many families that need our love and our support. They need to hear from us, and they need to hear our encouragements, ladies and gentlemen, not our expectations, but they need to hear our encouragements. And that's one thing that I love about my mom and Miss Baldwin and Coach Hoffman, Coach Watson, Coach Marinoff. It was back in the day. They always encouraged me. They didn't have expectations of what I should do, what I should be, what I should accomplish, what I should do next. They simply encouraged me. And that's one thing that I want to encourage when you are working with your coworkers, or when you're working with your clients, or people back home in your own families, is that our children, everybody wants to hear encouragements and not expectations all the time. So I want to give that to you, and I hope that you take that and you put that in a good place. Now, let me talk to you real quick before I get into my message. You as the person, you as one of the kind, keep building, keep going forward to your greatness, because you're doing some phenomenal things. Now there may be somebody on this call, you're probably like in a place where you're wondering if you're doing it right. You're wondering if you're presenting it right, or whatever it may be. Hey, listen, you're here, you're in the moment. Some great things are happening. Keep going with it, keep staying with it, and keep going at it. So let me give this to you the best way that I can. I want to talk to you. There's 2 words I want you to hold on to. One is culture, and one is environment. Now, I don't just mean our traditional culture, right? I'm talking about the culture that you want. It's about establishment, right? So, believe it or not, I have a house full of athletes, and even though I feel like I am, the biggest athlete in my house, I feel like I'm the most competitive in my house, I know that I'm simply not the best athlete in my house, and I'm probably not the most competitive in my house. In my household, we have 8 national championships in our household. And at one time in my life, I was the only one that had the 2 national championships. And now, my daughters, they won some national championships in cheer. And now it's like we're all just trying to one up each other. But, what I credit it to, other than, creator, my Heavenly Father, what I credit it to is simply the environment and the culture in our home. So, and this is what I mean by that, is it is okay for you, ladies and gentlemen, it is okay for you to establish a strong, healthy environment. If that is having nice things, if that is, eating nice, if that is dressing nice, whatever it may be. One thing that I believe is that if you smell good, you want to do good. If you dress good, you want to do good. If you look good, you want to serve good, and there's nothing wrong with it, right? But you just have to make sure that your goodness comes from your heart. Your goodness doesn't need to come from your checkbook. Your goodness doesn't need to come from, your voice and what you say to people, because you could say one thing and do something else, but your goodness comes from your heart. So if your goodness comes from here, everything around you can be good, however you want it to be. You want to live in a nice house. You want to drive a nice car. You want to have good resources in your bank account. You want to go on vacations, whatever it may be. I know that there may be somebody on this call that says, must be nice, must be nice. Yes, it is nice. If you work hard, if you keep driving, if you keep going at it, if you keep being, that word again, resilient every single day, absolutely, it is nice. When you work hard and you establish yourself, you're giving yourself that freedom. I don't want to share with you like my daily activities, because I can't believe that I get to do the things that I get to do and go places that I get to go and meet people that I get to meet. When I was growing up and when I made this move to Enid, Oklahoma, not being eligible for sports or making bad grades and, having all this stuff happen to me. I mean, I knew that I was going to be one of a kind. Yes, I had all F's at one point, but I knew I was going to be one of a kind. And even though other people didn't see it in me, I saw it in me. And here's the thing, not only do clients see it in you, not only does coworkers see it in you, not only family members see it in you, but believe it or not, even yourself sees it in you. So when you hear that voice that is saying, okay, it's time for you to turn this chapter, it's time for you to do this, it's time for you to do, you're preparing yourself, right? As long as you believe, who would have ever thunk, hey, listen, you did, right? So get back in that realm, get back in that rhythm, get back in that place that's going to take you there. So talking about culture, the first one is your environment. Now, one thing that I do every single night, sometimes I don't like to do this. Keisha, I don't like to do this sometimes every single night. Before I go to bed, I clean up my entire house. I don't care if my kids left their shoes in the living room. I pick their shoes up, I take them up, I put it by their door, I knock on their door, hey, put these away. I do the dishes sometimes. I straighten up the couch because, my house is all girls, right? So they like to lay around and watch the Kardashian. Well, I didn't say that, but they like to lay around and watch TV or whatever. And they like to pull out their blankets and lay there. They like to kind of commentate, their shows or whatever it may be. And then when it's time to go to bed, because they have to go to bed early, they just all jump up and they run, they do their homework, brush their teeth, do their final things, do their final good night stuff. And man, sometimes they leave a cup of water out on the counter, or they'll leave their blankets, instead of me yelling out, hey, whose is this? Get down here, clean this up. What I simply do is I go and I clean it up, I put it away, and now I may tell them about it, but I get it done, because I want a good, strong, I want a nice environment. So here, the reason why I tell you this is because when I wake up at 6 o'clock in the morning and I get ready for my workout, when I walk into my living room, man, my living room is nice and clean, and the stairways is nice and clean. My office is nice and clean. My bedroom, my closet is nice and clean, because I want to establish a healthy environment. When I have a good environment, man, I want to do more. I want to accomplish more, right? If I have stuff laying around or stuff scattered out, that's how my life becomes. And listen, you already know this. I get it. I understand. You already know this. But hey, listen, sometimes it takes somebody else to tell you this, just to remind you. So environment is so important when it comes to building culture. Like I said, not traditional culture, but the culture in the home. So I give my kids, hygiene products to take care of themselves. I give them, I do put food on their table. I do, we do eat good. We do feed them good, and it's not always easy. Man, imagine running 7 kids and you got a grocery store budget, right? But I try to give them not the best of the best, but I try to give them what they need, right? And that's how it is with our clients. That's how it is with our coworkers. That's how it is with our children at home. We have to give them not what they want necessarily all the time, but what they need, and when they're given what they need and they're encouraged, instead of have expectations for them, you'll see the culture build in your home. So again, environment and to build your culture, what you're accomplishing, what you're establishing, and your environment, and it's good, and so I want to encourage that to you, as we break here from this 3-day event that we did. I'm very grateful and thankful that you guys have participated for all 3 days. I wish I was save the best for last, man. I'm just somebody that's just out here wanting to make an impact, wanting to make a difference, but I want to give that to you, is that build your culture the way that you want your culture to be built. If it's healthy and if it's productive, build that culture. Don't be ashamed that you're building that culture. Don't feel bad, for building that culture. This is something that I've always wanted to do. I had a hard time as a student, an all F student, and I found something. It was called running, and I wanted to use running as a way to build who I am up. right? I wanted that to be my bread and butter. Everybody out there, you have a bread and butter. You have that thing that is going to take you to the next level, right? One thing I didn't want to do is I didn't want to be good. I didn't want to be normal. I didn't want to be somebody that everybody else, you know, I wanted to be one of a kind, right? Because let me tell you something. I could have liked being a good runner, or I could have loved being a great runner. Let me tell you something. The opposite of like is love. If there's nothing else that you get out of my message today, I want to say that again. You either are going to like being a good employee, like being a good parent, like being a good advocate, or you're going to love being a great parent, love being a great advocate, love being a great athlete. I want to be one of a kind. I didn't want to come across first place just so I can have my name called, or because I was, you know, given a medal or whatever it may be. I wanted to be the best, because if I'm the best, that means I'm pushing myself. I'm pushing myself to the ultimate limit, right? They introduced me the other night at an event that I did up in Montana. And, you know, they talked about my accomplishments. And let me tell you something. One of my greatest accomplishments, you know, yes, I was a two-time national champion in the middle distance in track and field. You guys can't tell, but I was good. And I was a four-time All-American. But my greatest accomplishment was walking across stage with my bachelor's in social work, not because it was a degree, but because I knew I was capable of doing it. It's because I took all of those encouragements over the years from all those wonderful teachers, and not all the ones that didn't believe that I could do it or didn't want to see me do it, but I held on to the ones that meant something to me. Listen to me. There's going to be more people that are going to tell you you can't. There's going to be more people that are going to tell you that you shouldn't. There's going to be more people that that don't believe in you than that do believe in you, and that do believe that you can. You know, here's the thing. I never wanted to see myself as a victim at all. And I could tell you stories that would set me up in a situation like, man, I can't believe, you know, you had a rough life. Because let me tell you something, man, I did have a rough life, but I didn't want to focus on my rough life. I wanted to focus on what I was going to go get, what I was going to accomplish, right? Now, I want to say this in a mindful way, and I want to be respectful when I say this. Either you're going to be a victim or you're going to be a victor. And a victim is someone that may always give you a reason why they couldn't. But a victor is going to go out and be victorious. Now, the reason why I want to say that in a mindful way is because we've all been victimized in certain ways. Some of us nowhere near as some that has been severely victimized, you know, whether that's abuse or whatever that may be. But what we have to do is we always have to look at the wonderful ending, the wonderful stories in our life. We all have an opportunity to always bounce back and to build up and be strong and accomplish some things so that we can share them. Because there's people out there that need to hear your story. I know that I have 30 minutes, you know, on this talk, but guess what? There's so many people out there. You listening, we need to hear your story, right? You know, I've been invited, and I'm grateful and I'm thankful. But everyone who's listening, that you have a wonderful, amazing story. And when you share that story, you're going to share that story not as a victim, but you're going to share that story as a victor. You know, so that's what helped me. When I walked across that stage, man, I knew that I accomplished something because I focused on the encouragements and not on the expectations, right? And I want to give that to you. And as I kind of wrap up here and get into the final laps, and maybe, you know, we can kind of, I don't know if you do questions and answers, or I can, you know, do my best to answer them, you know, however it may be. I'm not anybody that's really good at questions and answers, but, you know, I knew I was going to be here, and I'm grateful and I'm thankful. And I also knew that it was time for me, and there was going to be a time for me in life where I have to give it back, right? So there may be somebody sitting there right now, you know, that it's time for you to give back to your community, give back to your cause, give back to your church, give back to an outreach. You know, you're sitting on a gold mine, and that gold mine is you. You are a wonderful gold mine. You are a one of a kind. So now it's just time for us to get up, get with it, go make an impact, go make a difference, right? Like I said, I did not want to be normal. I wanted to be the best of the best. And even today, as a runner back then, even today, man, I love being great every single day. Because when you love being great every single day, there's going to be so many opportunities. There's going to be so many opportunities for you. Now, this is just my personal perspective on something, okay? Like Keisha was saying, you know, I have a strong faith. You know, I pray every day. And anybody out there, tribal, indigenous, First Nations, whatever it may be, we are who we are because we're wired this way, right? We are one of a kind. We are, as tribal people, we are wired this way, that spirituality is number one. Colonization, genocide, massacres, you know, all these things that were taken from us, all the things that we've been through, right? Nobody ever felt sorry for us, right? It was our spirituality that kept us real. It's our spirituality that kept us living, right? And that's why I'm saying it's so important to give back, right? But as I wrap up here, sorry, I know I talk fast and I talk a lot, and I'm glad you guys only gave me a little bit of time because we'd be here all night. But, you know, as I wrap up here, you know, I knew that it was time for me to give back. And this is what I learned. I learned that Creator doesn't open doors for you. They're unlocked. It's just up to you. Somebody out here right now, you're listening to me. That door has been unlocked. And it's time for you to open it. And not only open it, but go through it. Go through it, because on the other side of that door is another journey that is going to be unexplainable. It's going to be amazing. And you're going to find yourself one day not believing that you get this opportunity, that you get to do the things that you get to do. That's how I look at life every single day, is I know that there are so many doors out there that are unlocked and ready for me to go through, ready for me to walk through. Here's one of them. About 3-4 years ago, right before the pandemic, there was a TV, there was the news came on, and they were talking about a movie coming to Oklahoma. And I looked over and I told my wife, I said, I'm going to be in that movie. And my wife was like, I know you are. I know. I said, no, listen, I'm going to be in that movie, and I'm going to have a role in that movie. And when that movie is over, my name is going to be in the credits. And here's what's beautiful about it. When you roll with someone, when you rock with someone, man, when you believe in someone, and when you march with somebody, you know, there's a reward in that. So I say this in closing. Don't tell people that you believe in them if you don't believe in them, because we'll see through it one day. Don't say you're going to do something if you're really not going to do it, because we're going to remember that one day. Go all in with them. If you believe someone is going to do some wonderful things, go all in with them. So big shout out to Coach Watson, to Coach Marinoff, to Keisha, to Miss Baldwin, all these people that went with me, right? And there's so many people in your life right now that is just ready for you to be on their team. When you're on their team, you be fair to them, and you go with them, and you encourage them. Not have expectations. You encourage them. Not have expectations. You encourage. Great things are going to happen, right? So my whole family was in. Like, all right, you say your name's going to be on the bottom of the screen. It's going to be at the bottom of the screen. Audition for the part. Man, everybody was getting callbacks. I wasn't getting callbacks. My friends would call me, hey man, I got in the part. I got this part. I'm an extra. Chance, you should try to audition again. I thought about doing it again, but you know, you got to stay on your course, because I know that door is unlocked and I already went through it. Great things are about to happen. When I got on the other end, finally I got that phone call back, and it was the casting agent. She said, we would like to offer you the part as Bill Stepson in the upcoming Martin Scorsese film. Now you die in the movie, but you get to be in it, right? And so when I got on set, and I was on set with all one of the greatest directors in the world, and some amazing actors and actresses. I was on that set. And before I walked out on that set, I remember that my agent called and said, listen, you're one of them now. So don't get starstruck. You're one of them now. And it made me think, what would have happened if I would have never went to open up the unlocked door? Greater things are on the other side. And when I hung up the phone with her, and I was thinking, man, I said that this was going to happen. Here's what I want to say. As professionals, as parents, as coworkers, and most importantly, as people, if you believe something is going to happen, there's a good chance that it will. If you believe that you're going to be normal, if you believe that you're going to be ordinary, if you believe that you're going to be like everyone else, there's a good chance that it's going to happen that way. But if you believe that you are one of a kind, if you believe that you are phenomenal, if you believe that you are truly going to make a huge impact in this world, there is a good chance that it's going to happen. In the industry that I'm in now, I have a 15% chance of being successful. So what am I supposed to do? I'm supposed to run off and go do something where I'm going to be successful? See, I've been told no by all these directors and everything that I auditioned for. I auditioned for over 15 projects, and I've been told no 13 times. 12 times. Chance, your track record isn't that good. Not now. Not now, it's not. But here's the thing. I'm not focusing on the no's. What I'm focusing and what I'm getting ready for is the big yes. I'm not worried about the no. I'm getting ready for the big yes. You know why? Because I believe that I'm going to be a good actor. I really believe in that. And because I believe in that, I know that there's a good chance that will happen. So I just want to share with you in closing is we can go over here because everybody goes over there. And we can roam in that world because everybody else does. Or we can stick to it. We can go over here and we can open so many doors that aren't locked. And some of us don't even know that they're unlocked because we're too busy sitting on our gold mine. Get up, take your gold mine, whatever that gold mine is, go and open up those doors, go through them, because there's something phenomenal on the other side. I want to thank you all for your hard work and what you do in Indian country, what you do in Indian communities, whether you're native or you're not native, it doesn't matter. I'm thankful for all your hard work that you do to make a stronger community for our families and our children, or how vice versa, whatever way it's supposed to go. But thank you for your hard work. This is what my grandpa used to tell me. He used to say, if you work with us, if you live amongst us, if you serve with us, then you are us. To constantly made everybody, Creator God, Heavenly Father made everybody to be one of a kind. Different colors, different nationalities, for all of us to work together and play our part. So I want to wish you all the very best in your outreach and the work that you do, and continue to stay resilient. Because even though we hear that word all the time, I love being resilient. I'm going to be resilient tomorrow. I'm going to be resilient tomorrow when I'm on that Peloton, or when I'm out at that golf course, when I'm in that meeting, on the radio tomorrow. I'm going to be resilient because, if tomorrow comes and it's promised to me, I'm going to make a promise, right? If something's promised to you, you make a promise. So I want to thank you guys for letting me sit and visit with you And with that being said, I'm Chance Rush at tribalunite.com. I'm also at chancerush.com. I would love to come to your community, be a part of it. Keisha Smith, that's why I know you by as Keisha Smith. I want to thank you for giving me the opportunity to be a part of your program. And truly is an honor to be close friends with you and also Corey and everyone else. So with that being said, man, here we are. We did it 3 days, it was an honor to close it out. So Keisha, I'll turn this back over to you. Thank you guys very much for listening.
Thank you so much, Chance. It's been great connecting with you again. It's been a long time. It's been a long journey. Our families have been so close. Our mothers were so close and experienced some of the same things. And so it's always been so wonderful being connected with you and your brother and sister. And so my heart to you and to your family, to those girls. They're so beautiful. I can't wait until we're supposed to get together for dinner.
Yeah, we will. We will.
All right. But thank you so much. I think as we reflect on what's gone on these last 3 days, I think the one thing that we can all agree on is a common theme has been the resiliency. Another common theme has been encouraging and encouragement. And I think that's something that we've all been called to do with the people that we work with. I think it was so powerful for Chance to talk about those people that encouraged him, because those are the people that he remembers. Those are the ones that I think in those tough times when he didn't think he could push it another mile or he could run another step, it was the people that encouraged him, those who had his back that he continued to hear. Those were the voices that spoke to him. And so I think as we're working with our customers, that's something very important for us to remember when they're going through, when they think that they're not going to find the job, when they think that they can't, do another day, they're not going to be able to pay the bills, they're not going to be able to make the ends meet. If they hear us telling them, you can do this, we're behind you, we support you, we're helping you. If they know that we're there going along with them, that's the encouragement that they'll hear to make it to another day. So as we think about and we reflect on everything that has happened, I encourage you all to please take a moment and in the chat, feel free to highlight things that inspired you or things that touched you during this meeting. As you do that, there are several things that I would like to several people that I would like to thank before we end up closing out. One of those things that I'd like to first start off by thanking my colleagues, LaMonica Shelton, Karen Beckerman, the TANF program managers for Regions 4 and Regions 5 through 7. You and your staff, we have all worked together so great and so long, striving together to put together this conference, this meeting for everyone. So thank you all for partnering with me and asking me to partner with you, and for all of the amazing work that has happened. To our ICF partners, particularly Jesse and Zane, you both have put in so much work. I'm sure by now everyone knows Jesse's name. Jesse has spent countless hours, I'm sure, working behind the scenes, being in front of you. It didn't all just start today. We've been months long putting this together. Thank you so much for the awesome work that you've done. Thank you for working with us, for providing us with your feedback, for keeping us on track, because there were many times when we were straying over to the other side. So thank you together. Thank you so much for keeping us together. To the rest of the ICF staff, those who came along to help moderate, those who did additional work in the background, thank you for being there. Thank you for supporting us as you do. To our BLH friends, those that work with this logistics, they're the ones that make sure that this Zoom is set up together and it's working smoothly for us. They're the ones who've set up the registration and who got all the emails out. Thank you guys so much for always partnering with us and for all of the work that you do. We greatly appreciate you. We love the partnership. We love working with you. It's been a great journey. We're glad today it's done for now. Until next time. To our friends from Zoom, thank you for coming along and making sure that this 3 days ran very smooth, making sure all of the tech, the video, the audio is set up smoothly. And last but certainly not least, to all of you, to our tribal partners, our friends, our colleagues, our coworkers, those of you that are out there doing this work every single day. Thank you so much for going on this journey with us these last 3 days. Thank you for being there with us. Thank you for the awesome work that you all continue to do every day, through the good, the bad, the beautiful, the ugly. You continue to do the work, and we really appreciate you. And I would be remiss to also not thank the OFA TANF, the OFA TA team. Without them, we wouldn't be able to have it. It's the TA team that allows us to be able to do this. So to James and Damon and Lisa and Lizette, thank you so much. To Priscilla, thank you so much for going along with this, for helping us to get this set up and allowing us to be able to do this. Let's see. Last but not least, we are going to close it out in a good way. And we are going to close it out the way that we opened it up, with a closing prayer. So once again, I would like to invite Elaine Topsky, who's the program director of Chippewa Creek Tribal TANF program, to come on with us and to close us out with the closing prayer. Elaine.
Thank you, Keisha. Thank you to everyone. It's really been good as usual to connect with everyone, and you made it so much easier for us to be able to join everyone on this virtual meeting. It's amazing at what can be done now with all these, with technology, and this has been a good experience for me, and so many of the presenters put into words what all of that we're going through, and it's always meaningful, and that meaningful word takes on another level of being meaningful. So we have a lot to do here in our area of the country, but share with me, and I'm honored to be able to bring us to a closing in a good way as we go into the fall and winter. I pray and wish all of us that safety in all the good things in life that we have with us, with our families and the children that we take care of, because they're the ones that we do this work for. So help me in your thoughts to have some good positive feelings and words as we go forward. Asamina ka pinna nas kumuana no skagisigag. Igo bichet kigo ka pin momeukeak. Akso no mamaiwako ton my peaks gone. Magawitsi nan egwam amaka we get they stawiak. A chipugo takamewako tuak. Ni nano takamandaskinan. Ogimaga miwiti. We take ako kakyoge. A sino kapin which hayako kakyoga we teeth ako tahon kawi with the schema gigoge. Me said they sino Kanoiminan no tainan, Kanoy tamonan, dawsim sinanag no simnanag, atito ahoyo kapinayatig. Sa mama pinaitan, kaya tip tagwagi, kaya tipo pipog. Ekta kapin kanoy taksak pinuitiya kiwe ma tataskeon nan kapin mias kamin miuiti tigmitit oasag eksama mano te pinaitan no tainan hi. Thank you, everyone.
Thank you, Elaine. Thanks again, everyone, for joining us. Please, once we officially close out, you will receive, there will be a survey that pops up on your screen for a Survey Monkey. Please complete it. We'd love to hear feedback and we'd love to hear from you so that we can continue to make our TANF meetings a great experience for you. If you don't see it on the screen, you will also see that the survey link has been placed into the chat box. So please feel free to click onto that to complete your survey before you leave us for today. And with that, I bid you farewell until next time. Thank you all. Have a great afternoon.